What is the right age?
Ideally, the egg quality would be the best in our early 20s.
Yes.
If not, at least before you turn 30. So nowadays, infertility is on the rise. That we have to accept.
What could be the most important cause of
It
that?
could be pollution, it could be our sedentary lifestyle, it could be the work hours, the stress at workplace.
Stress also. Is it safe to have sexual intercourse
It is
during
safe.
pregnancy or not?
It is safe in
Ah.
most situations,
Okay.
but then it is about the woman's comfort.
So, what is the common problems you face in the second trimester of the pregnancy?
Second trimester is usually the best trimester. So the nausea, vomiting, it will all go
off.
away, and the third trimester will come with frequent urination or a bit of shortness of breath, all those things. Second trimester is relatively the best trimester, and if anybody wants to get a procedure done, second trimester is the safest.
Safest. Yeah, in fact, during our, we see sometimes cancer in pregnancy also. So, like breast cancer in pregnancy. So, that can come. And what we commonly do is we avoid chemotherapy in the first trimester.
Yeah.
So, basically, radiotherapy has to be completely avoided during that pregnancy. And chemotherapy we will avoid in the first trimester because that can lead to the drug going into the baby, and that can cause deformity. So first trimester we avoid chemotherapy, but second trimester we can give chemotherapy.
Okay.
And surgery is anyways avoided till the pregnancy is done. Then we'll wait for the pregnancy to happen and then go for the surgery. And yeah. So that is how even we see a lot of time breast cancers in during pregnancy. In fact, breast cancer is the easiest to manage during pregnancy, and in fact, breast surgery also can be done during pregnancy. Other than radiotherapy should be done after the delivery. But other than that, the surgery and the chemotherapy can be given. Only chemotherapy should be avoided in the first trimester. So that's how definitely second trimester is the safest
and best.
And third trimester, like they must be very anxious, especially in the last few weeks.
Yeah, and that's why we tell certain warning signs also in third trimester. Whenever you have a severe headache, or you feel you're not feeling the baby's movements, or you feel some water discharge or bleeding or something like that, come immediately. Even if it is a false alarm, there's no harm in going to the doctor and get checked.
Yes,
that is important. Instead of
in fact,
sitting at home and ignoring.
many people get that false.
Yeah, they'll be there. Yeah.
But still, it is worth going to the doctor and getting it checked. Once I had seen one patient who kind of the bag ruptured.
Okay.
She just came to the labor room that my bag ruptured, and suddenly she was sleeping in the bed and suddenly it ruptured. She felt like it was a kind of a blast and I fell off. And then immediately I think she was taken up for cesarean section and delivered. So that kind of situations can arise.
Unexpectedly things can happen.
So any precautions that they should take during the third trimester?
In third trimester, just be in touch with your doctor, go for regular checkups, get regular scans, ask the doctor what you should do in case of emergency, who to contact.
Yes.
The point of contact in case of emergency is very important, otherwise you'd panic. So just those things, and keep your file together at one place, keep your hospital bag ready, and be ready, be prepared financially.
I think you made a good video on hospital bag. It was good. It was good actually. Very good. It will help a lot of people.
Yes.
And
there's nobody like me, like how I'm giving education now. There was nobody like
no one was there to tell you.
To tell me when I was pregnant. Even though I was a gynec PG, when I was pregnant, I didn't have so much of information back then.
So basically, whatever you have learned the hard way, you are now telling that. How did this YouTube thing happen? Like how you got into the starting the videos for YouTube, and what motivated you?
The reason for starting this is to showcase my surgeries and the patient feedback, sir.
Okay.
Basically, that was the reason first. Because people would
When did you
assume
start first?
3 years, I
3
think
years
3
now.
years. Sir.
Okay.
So people would think that a young doctor cannot be competent.
Yes.
A doctor has to be experienced. The hair should go grey. You should have glasses. You should wear saris. More than qualifications,
These
people
things.
in South India especially look at the age.
Age.
Before they trust that doctor with their pregnancy journey. For cold and cough or flu, whatever, you can go, they can go to, they prefer to go to even young
Anyone.
doctors. But when you have to trust a pregnant lady, you have to have a lot of trust on that doctor. So that is the reason I've started it, is to showcase my skills. So people wouldn't trust. So that is the reason I started. But then I thought the same thing, small incidents that would happen, easily avoidable things, people are landing in big troubles. So that's when I thought I have to tell people about this. So that is how it started actually. No agenda, nothing.
It caught up well.
Yeah,
People
got
accepted.
connected because
People.
I don't think before doing a video. If I find something, some happy news to share, I'll do it.
I saw that, in fact.
If I feel sad about someone, I'd share it.
Some patient is complaining something, you immediately make a video of that.
Because that will help somebody.
Yes,
I
yes.
didn't know the videos are helping so many women out there. Many people are relating to the videos. I don't know how.
In fact, I think few are from US and all. They have commented that I follow your video and all.
I give online consultations also. Most of the clients are from USA, UK,
Okay.
UAE, Europe. Because they don't have access to doctors, good
Ah,
doctors.
okay.
Healthcare system, people have so many complaints about what we do here in India. But once you talk to the people living in UK and USA, you will understand how good the healthcare system in India is.
India is. So you had some people commenting from abroad also.
Yeah.
So you have fans in those countries. That's really a great achievement, in fact. Telugu.
Telugu and you won't believe it, some Kannadigas also,
Acha, they can
take
understand.
online consultation.
Okay.
And after seeing my YouTube videos, a couple came from Bhubaneswar.
Okay.
They don't understand Telugu and there are no subtitles in my videos, but they understood, they got some emotional connection, they were confident that I could help them, and they came to me on a festival day.
Okay.
They were not even sure I'd be there in the hospital or not, but they came to me. And they conceived in the second month itself. We don't know how things happen, but I think it's the belief, how strongly you believe in the people or the process. And most of the online consultation requests would be from USA, UK. Because if they want to see a doctor, it will take them weeks to months.
Wow.
Here, people do not have patience to wait for 1 hour. Sometimes the lady would come and sit and say, I have been waiting since 2 hours. So I said, are you waiting for me? My health? Did you come to me for my health problem or your health problem? That much patience and that much little respect we
Sometimes
should give
patient
to
will
Indian
come.
doctors.
Sometimes patients will come and call from outside. So, doctor, I am outside your chamber.
Those things also happen. But I feel very sad.
This thing you told, na, patient coming from Bhubaneswar and they conceived in next 2 months. This reminds me of a book, Secret. Book Secret, and it says that if you have that any positive thing in your mind, then those things will get attracted towards. If you have negative thing in mind, that will get attracted towards you. That's the law of attraction. It's a very good book.
Yes, yes. I told you that helped me. It changed my life actually.
Yeah, yeah.
It brought all good changes in my life.
Exactly. You had told me earlier, but definitely for the viewers, you should tell that.
See, we were struggling to get into post-graduation or PG degrees. So when I got married, both Shekhar and I were both MBBS graduates. Everybody would be getting married, feeling happy and all. When I was eating food in my hostel canteen, when I was doing my internship, when I was in my internship, I got married. I said my marriage got fixed, and my friend asked me, who is the guy? I said he's a MBBS graduate. What? You're marrying an MBBS graduate? She asked me to my face. I asked her, I'm looking for a groom and I'm looking for my life partner. I'm not looking for an employee or a colleague. So they were both struggling a lot back then. because we didn't have degrees. If we do jobs, we can't have
Study.
time to study. So we both were under a lot of pressure. After having comfortable life here in Vizag, we shifted to Hyderabad for coaching. And we rented a small flat, and we would sleep on the 2000 rupees mattress, and we would just have a few
Yeah, we
dishes.
all had our share of struggle.
Part was there. And then Shekhar got into PG. When we both had an opportunity, I said, first you join. If you don't join, I won't have my peace of mind and I can't prepare well for my exams. So he joined. And later I was working somewhere. I told you that
PHC, I
this,
think you
I
were
was
working
working in a
for PHC.
PHC. So I told you I've never boarded a bus, I've never boarded a auto, but then the struggle began. So I would take a bus from Beach Road to the complex, no, the railway station, and then I would take a train that would go to Ponduru or Rajam or Chipurpalli station, I think. And then I would take two share autos, or sometimes if I'm lucky, I would get one share auto, and then I'd go to my workplace. And then I'd work there, and then the same two autos, one train, again one bus to reach home. So this was my routine. And after reaching home, I was trying to read. So it wasn't working out. So I thought this is not going to happen. So I have to shift to a place nearby. That's a village. There are not much facilities. So I shifted to a nearby town. And I started preparing there. And then accidentally, it was a Diwali. Shekhar was doing PG. He couldn't come visit me, and my father was working elsewhere, so my mother was there. So I was alone. It was a festival day. Outside, everybody was celebrating. I was a bit depressed. Then I randomly found this book, The
Book.
Secret. It was just magical. Once I read it, I started to change my outlook towards my life. Every time when I would give an exam, there'd be a lot of anxiety and a lot of negativity basically. Am I going to make it or not? It's most likely that I'm not going to make it. That was the attitude. So before reading that book, whatever exams I've given, I didn't crack it. After reading the book, I probably was in such a phase that I assimilated everything that was there in the book. Many times we read a book, but we can't
Correct.
get that proper information from the book. But this time, everything was right. And then after reading the book, I started attracting things positively.
Yes.
I had good 3 to 4 people who were trying to prepare for PG like me. So I had a good environment to study and good support. And then
Basically, that's the law of attraction in that book.
absolutely,
That's
absolutely. I think I attracted all those things. Things came in my way, and after that year, whatever exams I've given, I got good rank and
right.
short specialty seat in all the exams I've given.
Yes, I read that book recently. In fact, during my podcasts, one person had recommended, and I found it magical. It's true.
But one more thing also, sir, Shekhar always tells me the universe will send you the right person at the right time,
Correct.
or the right things will happen to us at the right time.
Right time.
So I would say I recently lost a friend who is very dear to me. Matlab lost means he's not dead, but he's not there in our lives anymore. So I was like, I was feeling sad. Shekhar said, it's okay. When we need something, the universe will help us. So probably that is how I came across that book. Or when Shekhar was sick, that friend helped us so much. Probably the role was still then, till that phase only. We don't know.
Yeah. That's correct. So you read all the comments of your subscribers, all the comments.
Yes, I don't reply to all the comments because I cannot reply. The questions they ask, if I can answer in yes or no, I will. Otherwise, I can't because it takes a lot of time
So
to
all the
type.
viewers should understand that Silpa madam reads all the comments and you should comment.
I read all the comments because I'd like to know what their understanding and what their concerns are. I
Yeah.
read the comments and then I decide the next topics.
Yeah, from there
Okay,
only
this
you
is
get
what
the
they
idea.
want. This is
Okay.
what they want to know, or this is what many people are suffering from. Then I speak about it.
So that has also given a positive response from them in your next videos.
I don't know. As I told you, I don't plan on anything. If that is what I want to do, I'll do it anyway. I don't
You also
see if
get
it's gonna
negative
work.
comments.
99.99% are positive comments. Very few are negative comments, but they're very bad comments.
Okay.
You cannot imagine that these many people are liking the video and there is an idiot speaking like that. But then initially I tried to reply, how can you do this to me? What do you know about me and all? And later I
What
said,
kind of comments exactly?
See, let us say we are talking now. I'm not mindful about my sari, right? It can slip,
Okay.
right? It's not a mindful act.
Okay.
That also they'll pick up. You're being a
Oh.
doctor. How can you dress like that? You're talking like a tagubotu, drunkard. You're talking
Oh.
like a tagubotu, and you behave like a bar girl. I don't know from what angle do I look like that. I don't care at all. And in Telugu,
And in
bad
the
words also.
social media, basically people judge. I don't. They judge as per their psychology, basically, and we need not to really worry and bother
Absolutely
about it.
true, sir. Because whatever that person is saying, he's saying from his perspective. That is how pathetic or upset or ugly person that
That
he is.
his mentality is.
That is not a problem. When somebody comments on YouTube, they're anonymous, right? So let us say he doesn't. We don't know his identity. He has the. He dares to speak whatever he wants. But imagine the same thing happening on Instagram. See, Instagram, we can see who have commented.
Yes.
We can check out their profiles. We can see his face. That means he knows what he has said about you. Right? You know his identity, yet he doesn't care. But where are we going?
Yeah.
With this attitude, what kind of society are we living in? You know that you have hurt me. I also know that I know you that you have hurt me. Still, you don't care.
They don't bother. They
But
don't
that is
bother
not the.
about it.
I don't know. Sometimes I feel that the society is not a very safe place.
Not exactly as you said. 99.99 people are
I don't care about
safe.
them now. Just block them.
Just 1% people will be there. We just have to, I think, ignore.
I do it.
Ignorance is bliss.
Nowadays. I don't even read the all lines. If I think the first line is, if I
Positive.
expect where it's going, I'll just hide that user. But because I do not want other person also to take that negativity. I do not want that comment to show.
How do you take all these like your the stress related, because of after seeing these kind of comments and all, you'll definitely feel kind of disturbed. And how do you take it to your family, like after you go home, are you kind of happy or disturbed based on these kind of comments?
The good thing is that I tend to forget things fast. I don't carry forward. If I'm very upset,
That's a
I'd
blessing.
probably call Shaker and tell, but I don't take anything to heart.
That's a blessing actually.
If a person abuses me also, I don't care.
Should
I'd get
not.
upset. Of course, I'm human. I'd get upset for 1 or 2 minutes, but then basically I don't have that much free time to give importance to that. We
Yeah.
have our own headaches and work, so
Tell me something about your family, your daughter.
see, whenever people think that I am successful YouTuber or I'm a successful gynecologist, you see only me.
Yeah.
But there are a lot of people that work
Sacrifice.
behind. A lot of sacrifices my family made for me. There was never gender inequality. That I should be very happy about. Because they never discriminated between my brother and me. They've always kept my needs ahead of theirs. Even when I was doing my intermediate in Sri Chaitanya Vijayawada, they would travel every week
To see
just
you.
to see me, because that's the first time I was away from home. Sometimes I wouldn't get confirmed reservation for train. They would stand all night and come visit me. They made such sacrifices. So family is everything. And whatever we are today, whatever character that we have, or whatever, like the attitude that we have, it comes mostly from
From
them,
the
I would say. Some things we changed, how life happens to us, but the basic core character, the basic principles, they're from our family. In that way, I feel very blessed to have a good family.
Good family.
Although I
Father,
don't spend
mother.
even 1 hour with Arya
Hmm.
on daily basis. Probably the quality time would be 30 minutes or 40 minutes or even lesser for some days. But she is growing to be a great person. I should
Maybe-
give my parents the credit for that.
Maybe she will be feeling more responsible. She may be being more responsible. In this situation, two things can happen. The child can become more responsible or totally irresponsible.
The first thing is happening with her.
Yes,
very
that's why you are
responsible.
blessed basically.
Yes, yes.
That's why
But
you
that
are
is also a
blessed.
conscious effort, sir. I never, I've always tried to make her independent of me. So whenever I thought that she's getting used to my presence in her life, I distanced myself. That was a
Okay.
conscious effort, because I was working, I was doing 10 night duties at a corporate hospital as registrar when she was a few months old, because I wanted to know how the corporates work, because I've been in government institutes only, and I was doing 5-6 night duties at KGH. So 15 days I was away from home. So if I cannot keep her away from me, she wouldn't sleep. She would keep crying. So
Right.
it's not gonna work. So if she sleeps with me for 3-4 days consecutively and she insists that she should sleep with me, I would tell her that you cannot sleep with me today. You have to sleep with Amma.
Ah.
That is how I trained her. And every child is special. We think we can take credit for that, but I think
You
they're
want your
special.
daughter to be a doctor also?
No way. No way. No.
Why?
To be honest, it's a very stressful job, sir.
Yeah.
And the times are changing. People are becoming more impatient, intolerant. They don't adjust, they don't try to understand, they try to find faults. If something has gone wrong, they will not even wait a minute to listen to your perspective. They just jump to conclusions. And I don't think India is a safe place for doctors. I don't think
Yeah,
so.
recent incident
Recent attack
happened.
also, normally also, we don't have any protection, right? Anybody can come and do anything. If they're not satisfied, they can come and slap us also. That is the situation that we are in. I don't think the money is worth the stress or the loss of personal life or the effort that we put in. We can happily make little amount of money doing something else. Right. Because of YouTube, I got success today. How many good doctors are becoming successful in their career or earning decent money? None. None. If I take my contemporaries, probably 1 or 2 people made it. Rest of the people, they're just working somewhere, earning 1 lakh, 2 lakhs, or less than that. I don't think.
Again, it again tells like,
I'm not saying I don't have satisfaction doing what I'm doing, sir. But when I think of the future, unless the healthcare system changes, probably it's
definitely.
not a safer place.
Yeah, there are few other things also. Like nowadays they are opening so many medical colleges without infrastructure. There are so many medical colleges which are there where people are like, let us say radiation oncology. There are centers where people are getting MD degree of radiation oncology without a radiation machine on that site. So that is going to give take out like untrained guys.
True, true.
So and they cannot sustain. They cannot sustain. Suppose we are able to do good work, it's because of the training that we get.
True.
It's because of the training that we get. Otherwise, that kind of training scenario is kind of going off. Definitely, it's going to be a challenge. Like our next generation, when they're suppose they're going to be doctor. In fact, I have not thought anything about my children. I have told them whatever you want to do, you do. But you have to do something after.
You have to be very good at what you do. That's the only thing I tell her. Yeah. Every profession is beautiful. You have to be the best at what you do.
Best at it.
And you have to be happy doing what you do. That is very important.
What are your bucket list in your next things that you have thought about?
I don't have any plans. I'll go however life takes me to. I don't know, sir.
Traveling, you don't like traveling?
I'm not much into traveling. I like exploring new places and new foods, but I'm very photosensitive. So I cannot, even if we go somewhere, I can't go out in the day.
Okay.
So I'm not
Get
much into
allergies and
traveling.
all.
Yeah.
Okay.
So my husband and my daughter loves to travel.
Okay.
Recently we'd been to Kashmir. It was beautiful.
Okay.
It's just to spend quality time with the family. I'd like to travel. Otherwise, I'm not much into traveling.
That's really great.
We're starting to build a hospital, a small center.
Okay.
So I hope it turns out well and it becomes
It
a
will
good center
turn
for
out.
women.
It will turn out.
So
In fact,
that's the only goal.
you have built your practice kind of organically with all the hard work and effort and honesty that I told from the beginning. And I think that will always show up. And that's what I believe, like we people do practice and patients, when they come to us, they can judge us if this person can take care of me or not.
True.
And if they don't judge us, we won't be able to sustain.
Yeah.
It's, in fact, I always say that like it's our mentors, our teachers, and they have basically built the personality and the training that they have given us, and that is why we are able to sustain. So definitely your nursing home which you are building at your new place. That will definitely be a successful. And anyway, I am close by. I live close by your home also. So, any kind of lows in your life or something?
Yeah, people will think that when they see a picture, they'd see happy faces. So whenever I post something or I frequently put WhatsApp statuses, they'd always say, "Who puts crying faces?" No, no. We always portray our happy faces. So people would assume that my life is all happy,
Yeah.
doesn't have any lows. I'm blessed with a good family, good workplace, and everything. But I do have my lows. So in fact, you were there when I was at my lowest phase
Yeah.
of life. So you tell me how I was back then.
I know.
Like
I know.
I called you from Trichy in a very
Yeah.
when I was in a very difficult situation. You know, my husband got detected with
Yes, yes,
pregnancy.
yes. In fact, I will tell you that again, your honesty, your friends, and all that has basically helped Sekhar, because first credit that goes for the cure of Sekhar was I will give all credit to Chaitanya, your friend who has taken to the surgeon who did that great surgery. And after that, in fact, again I will put it like it's the destiny. Even for your the radiation treatment of Sekhar, he was one of my most challenging case. And it was maybe God who involved like me and my very good colleague Dr. Yugandhar, and we both were kind of, it was a destiny which made us ki, okay, we both will treat him. And I can't basically tell you the technicalities, how much brainstorming we both had done. And we both even talked to each other that what we would have done if we would have treated this case alone. And it would have been really tough. Because disease going into the brain, how much dose we have to give there, where margin was status was said to be positive, and all those things were taken into consideration. But one thing about you, I will tell that the trust that you showed on us during that time, that made us very confident. And like I remember you saying that, sir, we don't bother about what happens exactly, but we'll do the best thing. And you had complete trust in both of us. And Sekhar was also a very good what you call compliant patient.
Very.
Usually doctors are bad patient, but he was one of the most compliant patient. And in fact, we also gave him the chemotherapy, which was quite aggressive also. And thinking that yes, we are not going to leave any stone unturned, and by God's grace, I think things worked out well.
I don't know if it's the God or something else. Some positive energy was there. He recently went for PET CT. So the morning he went for PET CT, the result was okay. Whenever the PET CT comes normal, we would celebrate. So I posted a WhatsApp status that him and I were sitting opposite to each other, and put a picture. And one of my juniors, she sent me, "Oh, lovebirds, how nice your life is, madam. You're enjoying your life."
Yeah.
What she doesn't know is that I've taken him for PET CT to know about the traces of cancer.
Yeah, yeah.
That is how misleading the social media is. And you said it's God. I don't believe in God, but I do believe in people. Somehow, the universe.
This is the universe. It's the
It guided us.
guided.
Because many people asked me how I handled that situation so well. But I would say I did not have any other option. I did not have time also to absorb what was happening around. Today he got the report saying that there was a tumor, and the next day we flew to Trichy.
It was like as the secret book goes, if you have your intentions, you had that thing in your mind, he's going to be cured. And that's how Chaitanya came into the picture. He arranged the surgeon. Then I think we never spoke. Someone gave
I've spoken to many radiation oncologists before I made a call to you. And I've spoken to some medical oncologists also. That is where the role of a good doctor comes, I feel, because you did not assure me that 100% ye ho jayega. But I felt some positive vibes when I've spoken to you. You initially said it can't be done in Vizag. You prefer proton beam. And after surgery, when I shared you the pictures, you said very confident that it will happen in Vizag. Come back to Vizag. I've spoken to 4 or 5 people. I've considered many centers all over India. But when you said that, I've decided this is it. We're going back to Vizag because after that is the best decision I probably have taken.
Yes, yes.
Because for surgery, I had to take a break of 30 days from work, and we don't have anybody around, we don't have friends and family around. It was very difficult.
Yes.
After coming back to Vizag, we were very comfortable.
Yeah, I think even radiation, so during that time you can do your work, and
Yeah, I
he
was
was
free.
also.
That time also, I drew energy and support from Shekhar because he never even once complained.
Yes, yes.
Why
I've
did it
seen that.
happen to me? Till date, he never asked. Why me?
Correct.
So, when we accept any situation, the brain will think and will be able to decide better.
Yes, yes.
But we are very fortunate to have come in contact with you, and
I think it's
it was very
it's the universe that
Yes.
basically align things. Not only me, even
Dr. Yugandhar and
Yugandhar, and even I was talking to Yugandhar few days back, and we both in unison kind of thing. Salute to the surgeon. He did a great job, and in fact, in cancer, the cure or not, disease get cured or not cured depends on few things. First is when we detect early stage or late stage. Second is how the treatment is done. If surgery is done properly or not, radiation is done properly or not, chemotherapy is done properly or not. Third is the tumor biology. Okay, tumor biology, like the nature of disease. That we don't know. It is like how COVID virus used to decide who will survive, who will not survive. So like that, even in cancer, that disease cells will decide whether we will respond to this treatment, will not respond. So it is again that kind of luck. The first two things is in our hand. We detect early, we will treat in the right way. But the nature of the cells, cancer cells, how they are going to respond, that completely depends on them only. We'll just have to leave it. So I always tell my patients, we just have to do the things right way and then leave it to God. And just pray God that it doesn't come back, they remain, and you need to be under checkup like that. So
and a lot of positive thinking also helps.
lot of that.
The willpower to survive and
Recently,
sustain.
I'll tell you one because after reading this secret book also, I preach my patients a lot. So recently, one patient came and she had one breast lump, which was incidentally detected, and the entire family was kind of nervous. Something has happened like that. Then I told nothing has happened. It is it looks like a breast. Definitely, it is positive cancer. Once I told that it is suspicious, everyone's eyes will pop up like this, and after that they will start consulting this, that they will consider, like, speculate everything. So I told them, see, if you think negative, all negativity will come to you. Okay. And I have also seen that if at all those people who are more kind of anxious, more something will happen to us, things will happen to them only negatively. And unfortunately, that lady, they went to one other place and got evaluated. You won't believe, now she has got 2 cancers at the same time.
Oh, but I think body also is very magical, sir. Our thoughts have the energy.
Yes, yes. We always have to have that positive thing. If cancer has come or a complicated pregnancy has come, it has its own solutions. We have to believe that.
But you've like kind of striken balance, sir. Like not giving 100% assurance, but then also making patients confident that you'll be there with them.
Yeah, it is like, see, I believe in honestly telling the patient that yes, we can treat or we can't treat. and many times many patients also go away for that.
Yeah.
But I think it's okay. And secondly, if we have 10% chance and that is safe for the patient, we can go for it. So like many a times, even you must be facing that precious pregnancy. They will be telling, this is my precious pregnancy, and the same thing is like the pregnancy, every pregnancy is precious to you also. Similarly for patients, they will like, my father will tolerate this or not. I always tell them, see, for you, your father is as important. For me, my patient is also equally important. I will also try to take care that he tolerates that. And whatever needs to be done, we'll do. But we have to do. If we don't do, we are raising our hand.
Yeah. Even Dr. Yugandhar also, you guys were very empathetic also.
Yeah, we had a very good team.
You said one word, sir. I still remember that. No, I think he said it. I was on that side of the table. I can imagine how it is.
Yeah, that's usually my dialogue.
Your dialogue only, yeah. One of you. I know how painful it is to sit there on the other side of the table.
I always tell my patients, because I always tell them nothing will happen, this will happen, that will happen, whatever. And then I tell them, because once one patient told me, how you will know what is I am going through. Okay.
True, no?
Then exactly. Then I told, yes, I exactly don't know how I am going through, how you are going through. I also don't know how I am going to behave if I am at your place. But presently you are in your place, I am in my place, and you have no choice, I have no choice. So that we have to respect.
Yeah. Everything starts with acceptance, sir.
Yes,
that I have
yes,
seen.
yes. So,
if we accept only, we can move ahead.
yes. So that's pretty what you call, it's a fact of life, and we have to accept that.
We have to accept things, and we shouldn't lose hope.
Yeah. In fact, definitely those steps during that time, support from the family, and even you told misleading people, mislead others during pregnancy. We see so commonly people mislead during cancer.
Ayyo.
Cancer, they will mislead so much. They will like, no, this will not happen here. One patient was there, he was misled by a doctor only. Okay, very senior doctor. That patient was going for simple chemotherapy from Vizag to New Delhi every 3 weeks just to get a chemotherapy done.
Oh.
Okay. And he did it for 4 months. They were affording, they had money, they can book flight and go and all that. They will come and cry, we are spending so much and all that. But they didn't have that trust that yes, that thing can be done here.
Yes.
So it is misleading people, even many doctors mislead also. People have to understand now is that every treatment is available.
People also think it is fancy to go somewhere and get treated.
Yes, it's fancy.
Some people have that attitude. Like
it's relatives.
People think the big buildings, huge hospitals have good doctors and good staff, but it is not so.
It's not so.
They don't understand that.
It is completely I never say you are going to so and so hospital. People will say, I went to Mumbai, so and so hospital, such a big name and all that. And I tell you, it's not important which hospital you went. What is important is which doctor actually treated you. What are the team members that he has got and how they have done. That is more important than which hospital. It's more of a fancy and psychological satisfaction for them.
That they've spent so much. And
they spend, even many people you will see, they have, let us say they have got a delivery done in Mumbai, some big hospital. They'll come and first thing they will tell, we got our delivery done at there. The same thing we face, that I got my radiation done there.
Doesn't matter actually.
Doesn't matter.
The quality of people matters. Quality of treatment matters.
Do you see this alternative medicines also in pregnancy?
Infertility.
Infertility.
I see, sir. A lot of people, they believe anybody who says anything because they're desperate. And many people take advantage of their desperation. A lady recently came, she said blocked fallopian tubes. Fallopian tubes block, it is either surgically treatable or not treatable at all. Apparently there is a place in Vijayawada, seems, where the doctor treats fallopian tube blocks. The patient went there, she ate antivirals, multiple antivirals, antibacterials, antifungals, everything she had eaten for 2 months, spoiled her health, came back in the same state. So they tend to believe it.
We face
People
the
exploit them.
other situation that from that patient go from curable stage to incurable stage.
That is very sad. That is
Very
true,
sad.
sir. Very sad.
Feel so sad, and they get misguided, and they're very vulnerable also. Same kind of like in pregnancy, they're so vulnerable at that time. They will get misguided by someone. Like in place of you guy giving good advice in YouTube, there will be thousands other videos who give all nonsense
Yes,
advices
yes.
also, and they will be following that also.
True, true, true. I've seen such incidents.
So those are kind of vulnerability of the people.
Maybe you should share some of those things with me later.
Mm-hmm.
Maybe I'll be able to make short videos. These mistakes happen, so please avoid those.
Yeah,
The purpose is
definitely.
to educate people only.
Yes,
Even if
yes.
one person gets benefited,
Yes, yes.
it's a win-win.
The reason why I have actually kind of stopped giving cancer videos, I used to do a lot of videos on cancer and telling scenarios and all that, is people don't want to hear about cancer. The word they will hear cancer, they will immediately close that.
But we all should accept that the incidence of cancer is on the rise.
It's on the rise. It's on
We
the
have
rise.
to be aware and
How
alert.
how does your perspective changed uh, after Sekhar's diagnosis and treatment when you see a cancer patient?
I am able to empathize with them more, and I've realized the fact that cancer is not just a disease or a suffering of one person. The entire family suffers.
Yes.
The family suffering is more than the individual suffering sometimes. Because when he was in the hospital, he was in ICU, he's such kind of person that he would sleep nicely. Even on the day of surgery, before the day of surgery, he doesn't have any thoughts about it. I would struggle to sleep. I would steal his Alprax and I would pop up pills and try to sleep, and I would wake up in sweat with palpitations. Is this real? Am I really in a hospital as patient's attendant? It's very difficult to accept that. And after coming back here, I started to go for work. But my family took care of him a lot. They'd make juices time to time. They'd give food, everything.
Family, the support of the family is
Immense.
most important. Including spouse and then the relatives, mainly
Yeah.
parents and children.
But I have also realized that life is short. Anything can happen at any time.
Anything,
We
yeah.
shouldn't take life too seriously.
Yes, yes.
We should try to forget, forgive, move on.
That's correct. That's correct. We should try to kind of, as you said, forgive. If anything happens, we should actually not take something. I'll tell you one thing, like prospective. Like what you are thinking, what I am thinking will be completely different. 2 days back, it was raining. So I was coming in the car. There was suddenly a pothole was there, and my car went on that, and there was a splash. One bike guy was going. I felt sorry, and I slowed down after that because I didn't realize. But that guy was kind of furious. Hey, you're driving so fast. Then I am trying to tell him sorry, but he's not understanding that. Then I could feel that it was raining heavy, and I could feel that nothing to make him understand, and so I was told, okay, you can leave. Then what that guy was like, his expression while going was, how arrogant this guy is. Okay, how arrogant this guy. So in life, I think before reacting, we have to think a bit of that perspective. And that is why he is asking you. That thing we have to now kind of think about that. Ki the other perspective also, it's beyond our what you call mind level understanding. It can also happen to some other. So that also we have to take into consideration in life.
As we grow, we learn.
Yeah.
You wouldn't believe me, I'm the same person if you met me 15, 20 years ago. I was very anxious, arrogant, moody.
Life changes.
Life changes us.
Yes. So nice talking to you, madam. In fact, I think we can continue talking for hours together, but viewers will get bored.
Yeah.
And so I definitely wish your future plan and the nursing home that will be successful. Your family will be, your daughter will be very successful,
Shaker
and
is healthy.
Sekhar is completely healthy
Right.
in his entire life, and your YouTube followers will grow beyond Deepika Padukone. And so, viewers, and before we complete, I would like to thank Silpa Madam for this excellent conversation. And if you have liked this, definitely like and subscribe and share with your family members. And thank you very much for being with us. Thank you.